I'm joined by gastroenterologist Dr. Sue Satcher and her patient Therese, who been trying to find out for a while where bleeding may be coming from in your GI tract. So let's walk through over here on our medical wall what these 3 different procedures do, the areas of the GI tract that they're able to examine. So we're starting with the bottom. So this is from down below. Walk us through what you're doing here.
So this is a colonoscopy. Typical procedure. We do it in everybody over 50 or anybody even younger who's having any problems. What this allows us to do is look at the entire length of the colon, which is about 5 feet. Doing this, we can look for ulcers, we can look for polyps, we can look for colon cancer, we can look for a lot of things that occur in the colon that can cause anemia.
And so there is the unfortunate reality.
Yes.
You have to get really well prepared for colonoscopy, clear everything out.
Especially the prep, yes.
And then this is what it looks like, right?
Exactly. So this is an example of a colonoscopy. Cleaned out, you could see there's no polyps there, there's nothing causing any sort of anemia, nothing to be suspicious.
So colonoscopy obviously visualizes the colon. Let's move on to endoscopy here, upper endoscopy. And so you're going to look at the upper part of the GI tract.
Correct. So upper endoscopy, the patient's asleep. We pass a long tube down into the esophagus, which is the food pipe, stomach, and only the first part of the small intestine. So though we can rule out ulcers and stomach cancers and problems with the esophagus, we really are missing a big part of small intestine between the stomach and the colon.
So at this point with Therese, both of these procedures, and of course you have to prepare for this as well.
Correct.
But both of these procedures, you saw nice, clear, clean mucosa, no source of bleeding.
Nice, pink mucosa, no problems.
So you're thinking, wait a minute, there's 25 feet of small intestine that we still haven't seen. Time for
a capsule endoscopy. So fortunately, this capsule came out in 2001, and what it does is it takes 2 pictures every second, and it generates a 55,000 picture movie. The patient doesn't feel any of this. They wear a sensor, and wirelessly, this is 2013, all of the pictures get transmitted to the sensor. They come back in 8 hours, they drop off their sensor, and then they go on their way. We then download it onto our computer screen, and we can read it and see what's going on in the small bowel.
And everyone sees now, I mean, this literally is traveling the entire length, and then it ends up
it's
in the toilet.
Right, and you don't have to look for it.
That's actually really important. You don't have to look for it. It's not digging for gold. So obviously you have to prepare for this very similar to your colonoscopy. You need to clear everything out because the last thing you want is the pill to get caught in stuff that's left over. So we have some images here of the pill cam.
So you can see it's a very magnified image. You can really see the villi, which are those finger-like projections that absorb food. So this is giving us a look at something that we never had access to before without having surgery. So it really brought us a long way in the world of GI.
And of course, what people are wondering is, Therese, did we find anything?
Well, fortunately for Therese, with her anemia, we found the most common thing that people with anemia have, which is called an angioectasia. And basically what that is a fancy name for a collection of blood vessels that can spontaneously bleed or bleed if you take aspirin, Motrin, ibuprofen. And because of that, she's probably causing her angioectasia to intermittently bleed.
So you've had her stop those, and how are you doing?
Good. I'm doing great. I feel good.
And energy levels are back, and you're happy.
I feel great.
And before we go to break, of the 3 procedures, I'm assuming the pill was the
easiest.
I mean, you didn't know it was there, right?
No, it just felt like I was swallowing a vitamin.
And you know, we just saw thousands of pictures of your small intestines, and they look beautiful.
Exactly. Thank you.
And technology truly is amazing. Thank you, Dr. Satcher. Thank you as well.